So on the day of the procedure, we've already done a number of tests to identify exactly what it is that we're going in to treat. So there's no issue about trying to uncover what the issue is. So it's a very focused procedure. We'll know our plan of attack in terms of, where our access is going to be, what tools that we would need, and so it's very direct and focused in that sense. Patients arrive in our center early in the morning. They'll go through a sort of intake with our nurses where all of their past medical history and medications and everything is reviewed. Everything is sort of all, I's are dotted, T's are crossed in terms of prior to starting the procedure. The procedures themselves, depending on what we're doing, if it's not an involved case in terms of, a very short lesion or something we need to treat, it doesn't take very long. Others can be very more, time consuming because of what we're doing. On average, you can expect somewhere between an hour and a half to 2.5 hours on these procedures. And the recovery times are quite tolerable. It's usually about 2 to 2.5 hours after the procedure that you'll be in our recovery area. But they're all same day procedures. You'll go home with very limited in terms of what your restrictions are. Usually the recovery is about 24-hour period where we ask you to take it easy, no heavy lifting, no exertion and things like that. And then after 24 hours, it's business as usual. So it's a pretty easy course in terms of the procedure and recovery, and hopefully we get you back and going within 24 hours.